Turmeric, cinnamon, fish oil, every bottle claims to help diabetes. But for seniors, some supplements do more harm than good. Before reaching for that next pill, it's important to know what's really helpful, what could be risky, and when it's time to talk to your doctor. For many older adults living with diabetes, the desire to do something extra often leads to shelves crowded with supplements. It feels proactive, like you're taking control of your health. But these bottles of good intentions can quietly interact with your medications, unsettle your blood sugar, or even strain your kidneys. As we age, our bodies process nutrients and medicines differently, making it even more important to pause and ask, is this supplement truly safe for me? Let's talk gently but honestly about what's worth considering and what needs a conversation with your healthcare team. Let's start with a few supplements that might offer some benefit for diabetic seniors, but only under a doctor's supervision. First, vitamin D3. Many older adults, especially those who spend little time in the sun, have low vitamin D levels. This deficiency can actually worsen insulin resistance and affect bone health. If your doctor finds your vitamin D is low, a supplement may help. But don't guess. Get tested first. Next, magnesium. Magnesium helps regulate blood sugar, but again, only if you're actually deficient. Too much magnesium, especially from supplements, can cause problems like diarrhea or even heart issues. Try to get most of your magnesium from leafy greens, nuts, and whole grains. Only supplement if your doctor recommends it. Cinnamon extract, specifically Ceylon cinnamon, is sometimes promoted for blood sugar control. There's some evidence it might have a mild effect in lowering glucose levels, but it's not a substitute for your prescribed medication. Importantly, avoid cassia cinnamon, which can contain high levels of coumarin, a compound that can harm your liver in large doses. If you're curious, start with using cinnamon as a spice in food, not as a high-dose supplement. But what about the risks? Some supplements can spell trouble, especially for seniors managing diabetes. Fish oil, for instance, is often suggested for heart health. While it has some benefits, it also thins the blood. If you're already taking blood thinners like aspirin or warfarin, adding fish oil can increase your risk of bleeding. Always check with your doctor before combining these. Alpha-lipoic acid is popular for diabetic nerve pain, but it can lower blood sugar, sometimes too much. If you're already on glucose-lowering medications, this can make your sugar dip dangerously low. And remember, natural doesn't mean harmless. Many herbal blends are not tightly regulated and can be tough on your kidneys or liver, especially in older adults. Supplements like bitter melon, fenugreek, or Gymnema sylvester may sound promising, but they come with risks of side effects and interactions, often not listed on the label. Your best protection is a frank conversation with your healthcare provider. Always bring your full supplement list, not just prescriptions, to every doctor or pharmacist visit. Don't rely on internet lists or social media advice. Your body's needs are unique, and what works for one person may not work for you. A supplement can't replace a lifestyle or a conversation. As we grow older, our bodies change, and something that seemed harmless at 50 may backfire at 70. If you're supporting a diabetic parent or grandparent, take a few minutes to go through their pill bottles together. Ask questions. Offer a listening ear. It's not about control. It's about care, dignity, and shared understanding. Ultimately, the best medicine is partnership. You, your loved ones, and your healthcare team working together. Supplements can play a role, but they should never be a solo act. Stay curious, stay cautious, and never hesitate to ask, because your health is worth that extra moment of attention.